a patient wants to donate, there is a number we have. They call and they're put to an intake coordinator, and the first thing you want to know is there's a little questionnaire to see whether they're healthy. If the donor says, I got diabetes, hypertension, you're not going to go ahead and take out a kidney because they might need a kidney later on. So it's a brief questionnaire. We look at the general health, and if that is okay, we first check a blood type. That's the simplest thing. Just make sure you're compatible with that particular recipient. And once that is done and they clear that hurdle, then they come for an intensive evaluation of all their body systems. They are seen by a nephrologist. They get extensive laboratory testing, checking out their kidney function, making sure their heart, lungs, everything else is okay, psychosocial. And then once everything is done, then they get finally a CAT scan of the abdomen to look at the anatomy of the kidneys, to provide us with a roadmap, make sure there's no abnormalities there which preclude donation. And then once all that is done, then they are discussed in a meeting. They're already seen by also one of the nephrologists who has a particular interest in live donation, Dr. Lentine. She's nationally renowned. So at a meeting with the coordinators, it's a multidisciplinary meeting, coordinators, surgeons, other nurses, other staff, the social workers, psychologists, living donor advocates. We're all there, we discuss the candidacy, and if everybody is okay with it, then only we proceed with the donation. If they're out of town, which we frequently have relatives, they come here for an initial workup and then they go back, and then we do a more extensive workup. Part of the workup can be done even locally. If the local physicians or a transplant hospital is willing to do that, they can also get the imaging done there. And then they can come here a week before to wrap up things, and then they get their surgery. They're in the hospital for about 2 days. That's the beauty of this laparoscopic method. And they stay for about a week or two locally, and then they go back home.